Hello, this is Dr. Mazhar Hussain from DMH Functional Medicine. We are going to talk about iron in relation to thyroid health. And of course, this is not individualized, personalized advice. And this is purely for informational and educational purposes. If you have any medical issues or health issues, you need to speak to your doctor. So I just want to stress before we get started, iron is found in every single cell in the body. This is not limited to thyroid health. Your overall body health, your energy level, your depression, your moods, your neural functions, the nervous system, the heart, every cell in your body is somehow dependent on iron. So it's required, but every single cell in the body. So don't make it a matter of just thyroid health. And I just want to go through some few things. Of course, I think many people know that it's important for the function of hemoglobin, which is involved in the oxygen transportation, and we need oxygen to every single cell in the body. It's also involved in energy production. It's part of the DNA synthesis. It's part of the repair processes if you have DNA damage. A lot of enzymes require iron as a cofactor. The immune system will suffer if we don't have sufficient amount of iron, so it has many functions. I've added hair production. Maybe that is not the most important part, but as you may know, I also do hair transplantation, so I think it's worth mentioning here. If you are having hair loss, it could also be due to iron. It can be due to many other things. It could be deficiency in zinc, in biotin, in protein intake, and so on. But iron deficiency can also cause you to have hair loss and even accelerate your hair loss. Unfortunately, in conventional medicine, a lot of doctors would do a CBC, a complete blood count. They'll look at your hematology, and if certain parameters are within normal limits, if your HB hemoglobin is normal, if your MCV, MCH, and MCHC are normal, most doctors will not even consider doing any further testing, because they would say, well, your CBC is fine. Maybe some doctors might even go and check ferritin, and unfortunately the reference value we use for ferritin is not optimal. And keep in mind, iron deficiency is the most common nutritional deficiency in the world, and partly due to a lot of women lose blood during their periods, and they spend maybe 1/4 of their reproductive life trying to restore that blood loss, the iron loss that you also have there. So a lot of women are iron deficient. Vegans are at a greater risk of iron deficiency. They need to take nearly double as much iron in their food, in their diet, simply because non-heme iron, which is more common in vegetarian food, non-heme iron is less absorbed. You also need to ensure that you have sufficient amount of vitamin C with your iron intake. Even if you're supplementing, it's a good idea to take iron separate from other supplements and on an empty stomach, along with vitamin C, to increase the absorption of iron. But what is important to remember is iron deficiency anemia is not, as I just said, is not the only factor you need to consider if you are having iron deficiency or if you suspect iron deficiency. I want the ferritin to be minimum 40, and preferably if you're having hair loss, I want it to be above 70 also. So a lot of labs would have a normal range that says above 15 for women and maybe above 20 for men. I simply do not see this is sufficient. You do need to be much higher, above 40. And if you are experiencing hair loss, I would also try to bring you a bit higher up than just 40. But iron deficiency anemia should not be the criteria for you to have further investigations for iron deficiency. You could very well be iron deficient without having any anemia whatsoever. So let's talk about the iron's role in thyroid hormone regulation. So TSH is produced by the pituitary. The TSH, thyroid stimulating hormone, travels to the thyroid and stimulates it to produce thyroid hormones. And if you're lacking TSH, it will have the thyroid gland will have less stimulation for the production of thyroid hormone. It's also important for the regulation of prolactin, and if you have iron deficiency, you can have higher levels of prolactin. It's important for sex hormone regulation, gonadotropins, follicle stimulating hormone and luteinizing hormone, and deficiency can cause you to develop irregular periods, infertility and decreased libido, which is of course of a great concern. And then again, if you're suffering from, say, infertility or decreased sex drive, maybe the answer is not just giving some Viagra or some other medicines. Maybe the answer is we need to look into this and see what is the cause of your deficiency. Symptom control is not the approach we have in functional medicine. We want to dig down and find out what is causing this disorder, what is it that makes you have this symptom. And if it's down to, say, iron deficiency, if it's down to zinc deficiency, or if it's down to stress, well, I think it's better to address those factors than just go on to control the symptoms. So iron is also vital for the conversion of iodide to iodine. Iodine is then attached to the tyrosine amino acid on the thyroglobulin to form T3 and T4. Well, it's not directly forming T3 and T4, it forms T1 and T2, which can then go together, or you can have two to produce T3. You can have T2 and T2 here, which can then produce T4. But in the production of these, you do need iron. It's also required for the deiodinases D1 and D2. Keep in mind T4 is converted to T3 and reverse T3. These two enzymes D1 and D2, they require iron. We are not fully sure what the role of iron is in D3, which is the conversion of T4 to reverse T3. Keep in mind, reverse T3 is the inactive version of T3. It has some similarities. It's similar enough to be able to bind to the thyroid hormone receptor, but it does not activate the processes that T3 would, and is then hindering T3 from binding to the receptor site. So if you have too high levels of T3, or the ratio between T3 and reverse T3 is disturbed, is deranged, well, then you could have a functional hypothyroidism on the cellular level. So this was a very brief presentation of iron in relation to thyroid hormones. Do like the video, share it with your friends and family. Iron deficiency is, as I said, one of the most common, well, it is the most common nutritional deficiency in the world, and chances are women in your network would be suffering from iron deficiency or have a great risk of suffering from iron deficiency. Do subscribe to our channel and click the notification bell so that you get updates as soon as we are out with a new video. Thank you for watching.